Good afternoon, everyone. Welcome to today's press conference for Friday, the 15th of January. Today, we're joined on the panel. We are live streaming on YouTube today. Thank you for attending. So today on the panel, we have Lucy Whiteman, Director of Public Health for Northamptonshire. We have Deborah Needham, the Chief Executive Officer for NGH, Northampton General Hospital. We have Superintendent Elliot Foskett from Northamptonshire Police. We have Toby Sanders, Chief Executive of NHS Northamptonshire Clinical Commissioning Group. And we have, I presume it's Dr. Jamie Green attending on behalf of Joe Watt. So thank you very much. What we'll do is the running order will be Lucy, then Deborah, then Toby, then Elliot, and then we'll open up to the submitted questions as we always do. As we do every week. If everyone could please mute on coming in, that would be great, because we do often get a bit of feedback. So I'm going to go straight to Lucy for her report on the figures for the latest period. Lucy, thank you very much.
Thank you, Councillor Morris, and welcome everybody. Good afternoon. So we're just going to bring today's report up, and apologies, it was slightly later being signed off today. There's clearly a lot that's been happening. We wanted to make sure that we had all of the most up-to-date data in there for you. So this report obviously covers, as always, just slightly a week behind ourselves, so it contains data up to the 10th of January 2021. And we've got a number of headlines, as you can see. So we recognise, obviously, all of us, that we're still continuing in this national lockdown, and it's likely to continue, bearing in mind the picture from a point of view of case rates. And that obviously is being driven primarily by this variant strain of COVID, which is more transmissible and is clearly increasing case rates in many parts of the country, but certainly London South East and Northamptonshire. So those that were clinically vulnerable and shielded in the first lockdown are being urged to do so again, to make sure that they are obviously reducing their risk wherever possible of contracting COVID. And that's because, you know, a total of 4,604 Northamptonshire residents tested positive for COVID in the week up to the 10th of January. It still is very, very virulent locally. Mixing between households, despite the fact that we are in a lockdown, still continues to be the greatest cause of transmission. And by that, we're not saying necessarily that everybody is still visiting each other, though we are clear that that is still happening and it must stop. But we are still seeing significant transmission from one household member to another. So that isolation in a room away from the rest of your household members, that message is still not getting through, and is one of the key factors to reducing our rates locally and protecting the people that we live with and what we love. Those case numbers are still converting into, sadly, hospital admissions and deaths. So nearly 40% of our beds in the week up to the 10th of January were occupied by COVID positive patients, which is putting significant and continued strain on our services. So if we move forward, please. If we go to the first page with our latest data. So you can see really similar picture to last week. As you know, we do obviously update our case rates even in the retrospective week previous as those national numbers get updated. So it looks like last week was a slightly higher number than we reported previously. That's because we always update it as those test dates get backdated as confirmed positives. So last week, 4,645. This week, almost identically, 4,604. You know, and this is despite us being well into a lockdown period. So you can just see how transmissible this current strain is, and how we must stick with the rules, not just with regards to lockdown, but as I said, even within your household, if you test positive, excluding yourself as far as is physically possible from the rest of your household, stepping up that cleaning regime. We've talked about every touch leaves a trace. We must step up that cleaning. All of those touch points need to be regularly cleaned with dilute bleach solution. And as I said, wherever possible, that household member must try and stay away from the rest of the household. But we are still seeing household to household transmission. And that is because people simply are not adhering to the rules. If we go down, we can see the impact of that. So overall, a slight reduction, and I mean, it is very slight reduction in Northamptonshire cases. Those are primarily a reduced case numbers in Daventry, East Northamptonshire and South Northamptonshire, but they are marginal. But you can see here, Corby still going up, Kettering still going up, Northampton, Wellingborough the same. You know, this is a significant issue and a real concern that we can be this far into lockdown and still see these numbers increasing. And indeed, you can see that stat there just from the 7th of December, so almost a month previous, just in that month period, we've seen a 253% increase in the Northamptonshire rate. So really quite alarming. Sorry, total number of cases, I should say. If we go and have a look at the rates. If we can move on, there we are. So you can see that Northamptonshire is still statistically significantly higher than the rest of the country. That's being driven broadly by Corby and Northampton. But some of the other case rates are, you know, much higher than the East Midlands average and nearly where the England average is as well. So, you know, by no means can we be complacent in those areas that are currently statistically significantly lower. If we move on to the next slide. So from a point of view of deaths, and this is a really alarming, obviously, piece of news and the real concern with the continued high numbers in the over 60s. We had 55 deaths in the week between the 4th and the 10th of January. And you can see that every area has been subject to that. So all of these people have been lost in the beginning of the new year, just after Christmas, to something that is completely preventable. So we must do all we can to protect people, particularly those that are vulnerable to this in older age groups or with underlying conditions, to make sure that this number does not continue to rise. If we go on to the next slide. So I think this is always my favourite graph from a point of view of it just tells a really stark and easy to read story. So you can see Northampton and Corby's rates, they're rocketing up over the last couple of weeks, much higher than the dashed line, which is the Northamptonshire average, and much higher also than the England dotted line. But you can see there as well that the Northamptonshire rate has now overtaken the England rate. And bearing in mind that the England rate is being broadly driven by those high prevalence areas, so London and the South East, that is a real concern. As a county, our average is now higher than that includes those other areas. You can see, as I said, some tiny chinks of light from a point of view of a couple of areas with a slightly reducing case rate. But you know, we've got to make sure this is a sustained trend, and we've got to turn and bend the trend in the other areas as well. We're very, very concerned about the fact that lockdown has not had the impact that we would have expected to have done quite yet. We go on to the next slide. So again, lion's share of cases, broadly split between the two genders, always slightly biased by females, again, encouraging all males if they have symptoms to be seeking testing. But again, it's that working age population, 20 to 29-year-olds, 30 to 39-year-olds, very much driving the numbers in the last couple of weeks. We do recognise that those are age groups that are likely to be in more manual work. And obviously a lot of work has continued to be permitted under the current lockdown legislation, but we need to make sure that obviously people are not mixing outside of work, outside of those COVID secure environments, because that is where the transmission is happening, not within the workplaces. If we move down. So again, a very stark picture from a point of view of the over 60s. And as I've talked about before, and no doubt Deborah will talk about it again, we are still seeing pressure on our services, and they are broadly being driven by those older, more vulnerable residents. So please make sure that you are protecting them, if indeed you have to come into contact with them for caring responsibilities, but making sure again that you're just, wherever possible, you know, washing your hands, covering your face, and making space when you're having to obviously meet with those people for those caring reasons. If we go down again. So I'll leave Deborah later to talk about this in a bit more detail, but you can still see, as I said, that startling translation of that correlation between those higher case rates in that older age group primarily and our increasing number of beds occupied by confirmed COVID positive patients. So, you know, a stark picture, I think, and if the graph went back far enough, it would show a significantly higher number of patients in hospital at this point in the peak as compared to even the highest point in the March-April peak. So this is a real challenge on top of the already difficult winter pressure that the system always feels. If we move on. If we go, everybody always knows we've got these three graphs that show obviously not only the cases and the rates in the last 28 days, but also those areas that have had the most rapid change. So if we move on to move past the maps. And this is one of the other things that's quite stark. Because the virus is so much more transmissible now, we've seen an increase in the number of outbreaks in that sort of 7-day period. You can see now up to 43 active outbreaks. So do remember, these are not 43 new outbreaks in that 7-day period, but this is the number that are currently open and active and have been notified to us in the last 28 days. And they can remain open for quite some time. They don't get closed until that setting hasn't had a positive case confirmed for 28 days. So these are ongoing organisations and settings that we work with our environmental health officers, with Public Health England and others to support. As you know, we undertake routine testing in care homes, but you can see that that has increased. But you can see exactly what I'm talking about with regards to not having an issue at the moment within workplaces, but that is due to all the hard work that those settings are putting in as well. And you can again see, as we've talked about before, where we do have outbreaks though, we are seeing larger numbers involved in each outbreak and more complexity when we're unpicking how that transmission's happened. And I really can't emphasize enough, and I'll say it again, transmission is not typically happening within the workplace, it is happening outside where people continue to socialise. So if we move on. So flu, we always give you a quick update on flu. Again, the good news continues, and as much as we've increased the uptake this year as compared to last year, there's still more we can do. We still are in flu season. In fact, I only had my vaccination after Christmas myself. So those people that are still due their vaccination, if they chose not to have it previously, please do look at getting that. And for as long as it is available. The season runs through until March. And again, if you're due to have your flu vaccination, I really encourage you to do so. The more we can protect ourselves against any winter virus, but particularly respiratory viruses, the better this year. Okay, if we move on to next one. So just to remind people, obviously, going back to the beginning, we are in a lockdown, we are in tier 4, we are in tier 4 nationally, and we're in tier 4 for a reason, and that very obvious from our numbers. We need people to be complying. I'm sure we'll be talking about that more with regards to compliance shortly. But if anybody is in doubt about what they need to do, there is national guidance available. If any organisation is concerned about their ability to be able to maintain COVID secure environment, again, please contact your local environmental health team. We must make sure that every setting that we are living and working in is as secure as possible and that we're reducing risk wherever possible. So if I stop there, Councillor Morris.
Thank you very much, Lucy. Some fairly grim stats, unfortunately, this week. And if there's anyone out there that doesn't believe in coronavirus, I would point you to the 55 people who have lost their lives in the last week, and more that will lose their lives as a result of infection. So thank you, Lucy. I'm going to come now to Deborah Needham, who's the CEO of Northamptonshire Hospital, and who is living very much on the coalface of this disease. So, Deborah, we do appreciate you being here because I know how busy you are. Deborah, over to you.
Thank you, Councillor. So I think we've heard how the virus remains to be increasing within our community, and that's very much reflected across both hospitals where we've got some extremely poorly patients at the moment. In fact, our numbers now are almost double what they were in the first wave of the pandemic. The demand of patients coming into both hospitals is quite challenging, and on top of the COVID patients, we mustn't forget that we are also dealing with the expected winter pressures, which means that our staff are working extremely hard to keep everybody safe. Teams at both of the hospitals have responded fantastically well over the past 10 months. They just every day demonstrate outstanding commitment and dedication to caring for our patients. It's quite phenomenal, really. But saying that, we absolutely recognise that this pandemic is taking its toll on our workforce. So we've got a job really to help them get through this pandemic, and that's really important. So we have got teams that are involved in supporting our staff with health and wellbeing. We've developed psychological support for them. We've got actually a very wide range of measures to support all of our staff, their mental and physical well-being. Now, I think I can't go on really without saying it can be really upsetting for staff who are working so hard every single day to constantly hear claims that this pandemic is not real. If I could let people into this hospital, I absolutely would, so you can see it's real. This is real. People are saying that our staff are not busy and that there are some empty areas. That's not true at all. And I think what's keeping our staff going at the moment is the fact that the majority of the public know that we are doing everything that we can to keep everybody safe. And also our staff know that, again, the majority of the public are sticking to the rules, and that's important to our staff to be able to get them through this pandemic. And whilst I say this is upsetting, I know that it's the minority who are saying that this pandemic is not real, but even so, it's one too many. So as part of our response, an internal incident was declared at Kettering Hospital earlier this week. They escalated to the highest level of operational escalation, which we call Opal 4. What we have been doing across both sites is expanding our critical care capacity, as well as our overall bed numbers. We've been doing.
Sorry, we appear to have lost Deborah there. I think we've lost her from the link. So what I propose to do is we'll come back to Deborah and we'll come on to Toby Sanders, and we'll go back to Deborah should she reappear, which I'm sure she will. So Toby, over to you, sir. But that was some very stark information Deborah was giving us there, and I'm sure you're going to also give us some information that we will find very helpful. Thank you, Toby.
Okay, thank you, Councillor Morris. And I'm sure Debbie will come back shortly, no doubt, to finish off completing that picture, really, which builds on Lucy's kind of introductory piece about just how pressured we still are across the county and across health and care services at the moment. And of course, not only is the NHS in particular dealing with the kind of pressures that Debbie was just describing in terms of our hospital activity and our community and primary care services, the NHS is also in the midst of rolling out the biggest vaccination programme we've ever delivered in this country. And that's the bit that I wanted to update today's meeting in terms of progress that is being made. But it is important for us to remember that both of those things are happening at the same time. And that just goes to show the kind of commitment that's there across all of our staff to play their part in trying to find a way through all of this for our county. So I'm delighted to say again, report this week that we've had another week of really, really great progress and really strong progress in terms of rolling out the COVID vaccination programme across the county. If I give a bit of a headline in terms of where we are on some of the numbers and where we are in terms of some of the priority cohorts at the moment that we're really focused on, I'll then say a little bit about where we are in terms of some of the delivery models and the different places and settings that we're providing the vaccination service through, and then touch on a few forward-looking pieces. So in terms of where we are overall on rollout programme, to say Northamptonshire as a county has made really, really strong start into this. As of today, we have vaccinated over 45,000 people across Northamptonshire. So those numbers again, over 45,000 people across Northamptonshire. And I said on last week's call that the initial national priority of vaccinating the first 4 cohorts in terms of the nationally prioritised ratings here means that for Northamptonshire, by the middle of February, we're aiming to vaccinate around 135,000 people in order to be able to vaccinate everyone in cohorts 1 to 4. And that's all of the over 70s, health and care staff, and the clinically extremely vulnerable. So the fact that we've already got 45,000 into that in this short space of time, I think just goes to show the tremendous start we've got off to. In terms of what that means for the immediate priority cohorts, in terms of the over 80-year-olds that have been such a strong focus for us in the first few weeks of this, we've made phenomenal progress, not just in the hospital hubs, but particularly through our GP-run primary care network sites. So again, just to drop a stat into this, as of today, we're about 2/3 of the way through the over 80-year-olds across our county. So 45,000 people vaccinated to date, and amongst those, over 2/3 of the way towards vaccinating all of our over 80-year-olds. And of course, in terms of risk and harm and being able to protect those that are most vulnerable in our communities, that's just a tremendous progress to have made. We also, I'm delighted to say, are making good strides towards one of our other key priority cohorts nationally in terms of care home residents. And as of today, we are just over 1/3 of the way through vaccinating residents within our care homes. That's a huge focus for us over the next couple of weeks, and we've set ourselves the challenge of being able to vaccinate all of our care home residents over the next couple of weeks. So we'll give you more updates on that as we go through these sessions week by week. So that just gives a bit of a sense in terms of numbers, the scale of the programme and the progress that's been made. In terms then of the delivery models, where and how are we delivering the vaccine at the moment as we're having this conversation today? Well, we're delivering it through our 2 hospital hubs. So we're continuing to run a hospital hub at Northampton General and one at Kettering General. Those sites are increasingly focusing now on the health and care workforce. That's a nationally defined group of staff. That's not just NHS staff. It also includes independent providers. It includes dentists. It includes community pharmacy. Crucially, it includes our care home workforce, domiciliary care providers, and so on. So there's really quite a wide definition there that's been nationally set in terms of health and care workforce, and our 2 hospital hubs are leading the way for us on that. We also have live our 16 primary care network sites. So these are the GP-led groups of 3 or 4 or 5 practices working together across the county. That gives us really good coverage across the county and means that we've got those sites operating in all of our district and boroughs across the county. And massive thanks from me to the huge response from our GP community and their primary care workforce and volunteers who've stepped in to really roll out such big numbers, particularly for the over 80s over the last couple of weeks. In terms of looking ahead at where we're hoping to go next in terms of vaccination sites, I spoke last week about a larger vaccination centre that we're working really hard to get live and up and running within the county. You'll have noticed this week that the first 7, I think it was, large sites went live nationally, one of those in our region in Birmingham. We're putting in place the final plans in relation to that, testing our rotas and staff rotas and making sure that we've got the vaccine supply coming through. We're aiming to have that large site in the county up and running by the end of January. That is dependent on making sure that we can get vaccine supply through, but that's, that will come very close up, and that'll make a really big difference to our ability to do some very large numbers through that larger site. We're also aware of the national work that's been done with community pharmacy in terms of bringing, not in Northamptonshire yet, but in a number of other parts of the country, we've seen community pharmacy go live. We think that's a really exciting opportunity, particularly to get much more localised reach out into some of our communities that might still be a distance away from one of our other centres. And so we're working with NHS England, who authorise those centres, to see how well we can bring on some of our sites locally. We don't have anything signed off into next week yet, but I anticipate as we go forward, week on week, we'll be able to brief you more on that option as well. So just a final couple of words from me on the vaccination programme. We are still very much on track in Northamptonshire for that mid-February commitment that the government has taken around the top 4 cohorts. It does continue to remain dependent on vaccine supply and delivery, and that's our biggest kind of limiting factor in terms of the speed at which we can roll this out. But we know that the national bodies and the manufacturers are doing everything they can to work with us on that. And in terms of data, I anticipate, Councillor Morris, that there'll be a number of questions that will come through seeking more and more detail around the data. I'd love to be in a position where we can share more with folk. We will be able to do so over the coming weeks on that. And I know nationally next week there'll be another level of detail down again at more local level that will start to be published. But I've given some of the kind of headlines today, which hopefully gives some hope and some encouragement to people that we are making headway. But please do continue to stick with the guidance as we go through the next period, because we really need to buy as much time as we can to complete the rollout of the programme. Thank you.
Thank you very much, Toby, and you very succinctly put that at the end. No one wants to get ill now when there is a vaccine coming, because that would be heartbreaking for so many reasons. Deborah, I'm so sorry we lost you. So I went to Toby because I wasn't sure if you would come back on the line, but there you are. So I'm going to come back to you, Deborah. You were giving us a very good rundown of happening in the hospitals at the moment. Thank you, Deborah. Back to you.
Thank you. Technology at its best. So I think I was saying that we have started to increase our capacity in both hospitals, and that's been with help of our system partners, because we have still got some patients who are actually well enough to leave the hospitals. So we've needed to increase capacity to get those people out. We're also working at the moment with the private sector to continue as much of the urgent work as possible. This is the urgent elective work that we've spoken about previously. We have had to reduce some of our non-urgent treatments, operations and outpatient work over the last few weeks. And that's because we've had to put some of those staff onto the front line who would normally be seeing routine patients in outpatients, so that we can care for those people who really need us. But even with all of this hard work, our hospitals continue to be really busy, which means that all of us the whole community have got to do what we possibly can to reduce infections. It's just more important now than ever that we reduce all contact with other people as much as possible. We continue to follow all the advice and guidance about reducing the spread of this virus, and particularly continuing to wash your hands, wearing a mask, maintaining social distancing, sticking to the rules, reducing contact with other people as much as possible. This is going to keep us all safe. Now, if you are offered an appointment for the vaccine, please take it. I think that's the first thing. It's safe, and this is the beginning of our journey back to some sort of normality, a normal life, which is what we all long for. It's important also to stress that we are here for everybody. That's COVID patients, non-COVID patients. We are here if you need us in an emergency. But I would just ask people that you continue to choose wisely. So our A&E teams, as you know, are there for urgent and immediately life-threatening emergencies. So consider using other alternatives first, NHS 111, your pharmacist, for example. As I said, we have had to reduce some of our non-urgent activity, and that's to focus on the patients with the urgent and life-threatening conditions. If your appointment has been cancelled, we will contact you, or if we need to rearrange it, we will contact you. So if you don't hear from us, then please come as normal for your appointment. We continue across both organisations to work on cancer and clinically urgent surgery. Any other planned surgery has been postponed for the week, and that's because we therefore have to redeploy our staff. So final note from me really is stay well, keep up to date with your medication and prescriptions, check your GP and pharmacy opening times, make sure that you've got enough to see you through. Look after yourself, seek help really early if you feel that you need that help, rather than waiting until you get so unwell that you really do then need to come to the A&E departments. Do use NHS 111 as I've said. And if you have a relative or a loved one who is fit to go home, but perhaps are waiting a little bit of care that we're not able to get in today or tomorrow, then please contact us and let's get your relative or loved one home as soon as possible, especially if you can look after them for that 1 day, 2 days before the care can actually come in. to support. We can put additional voluntary support in if necessary, and we're really keen to get patients home to their own place of living. So thank you. Thanks, Councillor.
Thank you very much, Deborah. And I'm sorry you got cut off mid-flow there, but some very important messaging. And as we've said before, the majority of people are obeying the guidance, which brings me on to Superintendent Elliot Foskett to talk a little bit about those few people, or not so few people, who aren't obeying the guidance. And I'm sure he will tell us all about that now. Elliot, over to you, sir.
Good afternoon, everybody. Thank you, Councillor Morris. I think actually it's really important to say up front the huge majority of people in Northamptonshire do continue to act responsibly and are doing their bit. So for those of you who are, please continue to do what you are doing. It is working. We can see that it's starting to nationally as well. Even prior to the Downing Street conference, which some of you may have seen with the Home Secretary this week, Northamptonshire Police have been really ahead of this in relation to enforcement and taking action and enforcement where flagrant breaches have been evident. And that's been done to protect the community of Northamptonshire. I know I've talked about Christmas before, but I just want to say over that Christmas period, some stats for you. We issued 188 fixed penalty notices between the 24th of December and 1st of January. So nearly 160 of these issued on New Year's Eve alone. And now if you put that into context, the Metropolitan Police issued 217, so only 50 more than a county our size. So you can see just how seriously we are taking this and dealing with it locally. So whilst we do continue to take a proportionate response, it's fair to say that since this third lockdown, we've placed an even greater emphasis upon enforcing the regulations to support our colleagues. The Commissioner of the Met said it's unthinkable now after nearly 10 months of this that people don't understand the rules, and that's I firmly believe that. And I think to illustrate it quite starkly, Northamptonshire Police have issued 413 fixed penalty notices since this lockdown began, with 184 in the last week alone. So you can see they're quite high numbers. Those of you who have followed these press conferences over the past few months will know that they are quite high. So in response to that, I've made some significant changes to our response plans to ensure we've got sufficient resources to continue to attend every breach report we can, and we are attending a huge amount of them. Our dedicated COVID team continue to make contact with each and every person who contacts us. We've personally responded via email now to nearly 12,000 people who've emailed in online for different reports. However, moving forward, as we remain in this indefinite period at the moment of lockdown, officers will be conducting high visibility patrols across the county, through our towns, beauty spots, deterring gatherings at these locations, but also really to, it includes enforcing where appropriate. So a couple of things now. I want to talk about country parks. I know they're becoming a really increasingly popular destination, and we want to encourage people to get exercise. Clearly, we want people to remain fit, but we are concerned that sometimes these are being overcrowded. People are parking irresponsibly, mixing. We've seen families mixing that we wouldn't want to see as well. And that is going to increase the risk of that transmission. So we are going to continue to show an increased visible presence at these locations, folks. We will be out and about over the weekend, and where there are breaches of the rules, we will take appropriate action. Traffic flow, which had reduced to around 40% less than pre-lockdown figures, has started to rise again, unfortunately, and officers from our specialist traffic, interceptor vehicles, our other high visibility vehicles are going to show an increased presence on our road network. And we would urge you, if you are considering traveling, whether your travel is absolutely necessary. We don't want you to have to be challenged regarding your travel, but you may well be. Now, we may see more snow and ice over the next few days. I know that some people are talking about potential snow over the weekend. The risk of collisions is higher when that happens, and you risk then obviously a collision, which then places the ambulance service and other emergency service colleagues at even more strain. So again, I'll finish with we'll continue what we're doing. We'll support the COVID legislation. We'll enforce it where it's appropriate. We'll support our public health colleagues, because that's what this is all about. They're trying to keep everybody else safe. And we'll do what is necessary to prevent those minority of very irresponsible individuals putting others at risk within our community. And that's it from me. Thank you.
Thank you very much, Elliot. And as always, thanks to you and your colleagues for all the hard work you're doing to help to keep us safe. It really is important, and interesting to note that we are doing we're doing more numbers. We're enforcing harder than other police forces. And it's heartening to see the response that we get across Northamptonshire from our health partners and everyone else. I think it really has been an amazing team effort that has gone on in this county. We might be slightly biased, but I think it's absolutely true. So thank you for that, Elliot. I'm going to come now to the questions from the media, if that's okay with everyone. And we've got Kevin Nichols first. Kevin, hi, good afternoon.
Thanks, Ian. Sorry, it's a long time since I've opened the batting for anything, so I'm quite surprised by this. Thank you. I was just going to ask about care homes. I noticed the stats in the surveillance report showed a number more outbreaks and a number more locations. There's a report in the Telegraph front page this morning saying the numbers had tripled. I just wonder, we got some stats for the number of care home residents that have been vaccinated. I wonder if there's an equivalent figure for staff, and also is everybody happy that I think the care home setting is one that's going to be used quite widely for patient care when they're discharged from hospital.
Thank you, Kevin. I'm going to bring in probably a couple of people on that, I think. I'm going to bring in Katie Brown, who's our Director of Adult Social Care, because she has direct responsibility for the care homes. And then we may bring in Lucy as well, but we'll see. We'll bring Katie in initially. Thank you, Katie.
Thank you, Councillor Morris. So in terms of vaccination, the care home staff are a priority group, and we have been vaccinating care home staff in Northamptonshire since the beginning of the vaccination programme here since the beginning of December. In relation to care homes, yes, we have seen, not surprisingly, over the last 2 weeks, an increase in outbreaks in care homes, and we are continuing to support those services as a system, both through our infection prevention control team and through the support we have through the council as well. In relation to, I think it was a question asked by one of your colleagues, Kevin, in relation to COVID positive patients that are being discharged from hospital. In October, the government were clear that each local authority area had to have a designated setting so that if people were medically fit for discharge, they could go and carry and continue their isolation period in somewhere where they were not impacting on a care home where there was no cases, and we have one of those in Northamptonshire. Obviously, it's not appropriate to say where. So at the moment, if you are positive and you are fit to leave an acute setting and you cannot return to your normal place of residence, you go to the designated setting to continue and finish your isolation period, where you will then return to your ordinary place of residence. For customers or people that are being discharged that are COVID negative upon discharge, they are still required, the care homes, to follow all the national guidance that's been in place since March about isolating those care home residents until they have completed a period of isolation, just in case there is some transmission, and at the point where they leave, they're negative, but obviously we know that the test is only as good as it is on that day. So in theory, we are doing everything we can to make sure that we support care homes, and they have done a fantastic job, and we absolutely are grateful for their contribution in terms of how they're supporting us with the system pressures that we have at the moment.
Thank you very much, Katie. I don't think I need to bring Lucy in on that one. I think Katie answered that very ably. So we'll move on. Thank you, Kevin. I've got a couple of questions from Jack Duggan. Hello, Jack.
Hello. Are you okay for me? Sorry, yeah, just one more question.
You're a bit faint. Sorry.
Sorry, I'll bring my mic a bit closer to my mouth. Is that any better?
Perfect. Thank you, Jack.
Okay. So yeah, the Cron and the Northamptonshire Telegraph last paper, we've had a campaign trying to get more community pharmacists to be allowed to give out the vaccine from the government. So I know that's not what you're involved in, but I just wanted to ask, does the panel support this, obviously bringing in more community pharmacists to give out the vaccine, and how would they like to see them used?
Thank you very much, Jack. I think we would all support that, but I'm going to bring in Toby Sanders to give you the more detailed response than I gave there. Toby.
Yeah, thank you, Councillor Morrison. Thank you, Jack, for the question. As I touched on in my kind of opening sort of few comments, community pharmacy is now part of the national model. So there's a number of parts of the country that have already gone live this week in terms of community pharmacy being part of the vaccine delivery model. It's something that we would very much support and welcome, and do support and welcome locally. As soon as NHS England is in a position to be able to authorise any of the community pharmacy sites within Northamptonshire, which we have many well located and distributed across the county, then we absolutely are keen to build them into our programme and to work with them as part of that delivery model, not least because I think it'll help in terms of local accessibility in different parts of the country that might not necessarily have such easy access either into some of the primary care network hubs or into some of the larger vaccination centres as well. So it's something I'm expecting to see become more of a thing locally as we roll out going forwards, and we will work with NHS England, our regional national colleagues who are in the process of rolling out that kind of community pharmacy programme nationally. Thank you.
Thank you very much, Toby. And Jack, you did ask a question about impact of COVID and those that continue to deny the impact of COVID. I think it's important that I bring in Jamie Green, who's a GP, and possibly Jonathan Nunn in on that question as well. So, Jamie.
Yeah, no, so I think the question that was submitted was talking about, there was some anti-vaccine graffiti that had come out recently, and what the impact is of that on, on work and care workers. And I think, honestly, the clinical picture for both in primary care, but especially in secondary care, has been absolutely brutal. I think that's really key. But what I would say is, certainly I can talk, I'm sitting here at the moment in a vaccination centre. We're currently vaccinating, more than 1,000 people a week. And that brings us a lot of hope. And in reality, it's such a small proportion of people that are in this kind of anti-vaccine lobby, that in reality, it makes very little impact in terms of the good work that's being done across all of the PCN sites, the hospitals, and everyone who's vaccinating right now. We've got all sorts of people who are, coming across and volunteering for our centres. And genuinely, it's for the first time in this pandemic, we're giving care and we're smiling as patients leave our vaccine centre with a sense of hope. So in reality, I think the sense of hope is much greater than any sense of anti-vaccine type sentiment.
Thank you, Jamie. Very well put. Jonathan, I wanted to bring you in on that issue because I know it's something that you feel very strongly about.
Yeah, without doubt, Ian. Nobody can be anything other than amazed or angry or disgusted, I guess, that somebody would do such a thing in terms of graffiti and so on. Clearly, it doesn't reflect the view that so many of us have. We are absolutely in awe of the tremendous activity that we've seen on behalf of people across the health service, public health, and many of the public services. Most particularly, this tribute, I believe, was specifically to health service workers. So I think a couple of things occur to me in terms of the safety of the vaccine. Well, I'll have it as soon as I can. There's no prioritising for councillors or people like me, and there shouldn't be, but I should be straight up there as quickly as I possibly can. We've got my mum booked in, she's having it this Sunday. So I should say we should all go ahead and have it as quickly as we possibly can. I think when somebody does something, coming back to the sort of the criminal damage that's taking place here with this graffiti to this tribute, I suppose we partly try and think of why that is. Some of us might just think, well, there are bad people in the world, and perhaps that's evidenced regularly, but you've also got to look at the state of mind of somebody to do something like that, which I think perhaps shows a need for it's a sort of a cry for help, isn't it? It's a need to be noticed. I don't think, even if there are people who have considered concerns over a vaccine, this is not the way that they would express them. And I think that reminds us that perhaps we're dealing here with somebody who would normally not behave that way, but maybe they're feeling like the rest of us, complete lack of control over their lives at the moment with what the virus has done, and need to sort of express and kick out in some way, and this is the medium they found to do it. I don't mean to try and sound soft or overly forgiving, but there's absolutely something completely wrong here. In terms of what we say to people who continue to deny the impact of the virus, which second part, we've heard so much already. So many people have articulated that far more clearly than I could, but here are 55 deaths in a week is just incredible, isn't it? There is little doubt of the impact of the virus and frankly, in my mind, of the efficacy of the vaccine as well. Thanks, Ian.
I, like you, will be jumping in to get that vaccine as soon as it's available. And those that know Martin Griffiths, who normally joins us here on this meeting, he has been really quite ill with COVID over the last couple of weeks. So a very real example of how people can and do get ill around you. And of course, anecdotally, we all know people who have been ill. So I just, and I wish Martin well, and I hope he recovers well. He's not in hospital or anything like that, but he has been quite poorly, as I understand it. So we send our best wishes to him. I'm going to come now to Sam Reed or Stuart Radcliffe, or both, or one or both, for the next question from BBC Look East. Sam or Stuart?
Hello, yeah, it's Sam here. I've got two questions here on different issues, but I think one should be very straightforward. The temporary mortuary that was set up in the first wave, can I just ask for a clarification on if that is still operating? Is that working now, and at what level? And then a second question, we've featured a lot this week about the use of lateral flow, rapid lateral flow tests across our region, and how they are being prioritised for different groups and used in very different ways. How many lateral flow tests are being used in Northamptonshire at the moment, and how are they being used?
Thank you very much, Sam. Some good questions there. I'll come to Lucy first on the lateral flow testing, and she may be able to answer the question on the mortuary as well. I'm sure she can, so she'll probably take both of those. Thank you, Sam.
Hi, yeah, thank you, and thank you for both your questions. So with regards to the mortuary, yes, it's open, but what we want to stress, obviously, we are seeing deaths with COVID, but every winter we suffer pressure from a point of view of capacity with deaths. So this is something that we've been planning and had in the pipeline to get some additional mortuary capacity for quite some time. Obviously, COVID in the earlier part of the year escalated those plans. And we are supporting other areas as well, who equally have some challenges around mortuary capacity over winter, again, as a sort of standard, sadly, seasonal issue, as well as because of COVID. So yes, it is operational and up and running at this point in time, both to support the local need, but also wider need. From a point of view of lateral flow device tests, so we received our first delivery on Christmas Eve. So I think I've said before, it was a little bit later than expected, but a very welcome Christmas present. We've already started distributing those to various organisations, and we've got both a sort of a public sector arm to the programme, where we're working with police, fire and social workers to make sure that they are being have access to the test and are using it where appropriate. We've got a private sector programme arm to the programme, where we're working with large organisations. Matalan distribution locally has already gone live, and they are working and in fact helping us very much develop a programme of work and a best practice approach, and sharing it with other large organisations who have expressed an interest in going live, again very much in distribution and manufacturing areas, which we know are high risk settings for outbreaks, and it's one of the reasons that we report on outbreaks in those settings. And then we've got a third arm to the programme, which is the development of community lateral flow device testing, similar to that seen in Liverpool, although on a smaller scale, I'll be honest, simply because we don't obviously have the military support, etc., that somewhere like Liverpool had at the time it rolled it out. We'll be going live with lateral flow device testing in the community in Corby and Northampton first, the areas with the highest incidence, as we will have discussed earlier today with regards to our case numbers. And, you know, particularly Northampton has been consistently higher from a point of view of case rates. And so clearly we're working both alongside the university, who are supporting that because they were ahead of the game with lateral flow device testing they rolled out for their students, and we're learning from their development of their programme. But you'll be seeing more details in the next week or so. So as soon as we're able to obviously explain to people where those sites are and the booking process that will surround and envelop that, we will of course give people that information. But I don't want people to think behind the scenes that we're not already working with organisations, both private and public, to roll out lateral flow device testing. It isn't the answer to everything. People must recognise that they still, when they have lateral flow device testing, it is only telling you if you are infective. It doesn't tell you whether you don't have COVID. You could have it, but have only just developed it and not have a high enough viral load for that test to pick that up. So again, same as the vaccine, it doesn't negate the need for people to still behave very responsibly, to be washing hands, wearing their face mask, and social distancing. It just allows particularly key workers and people in high risk areas to understand if they have the infection on that day, if they're likely to infect others, and for us to get those people isolated and to break that onward chain of infection. So it's very helpful in certain settings to help reduce risk of onward transmission.
Thank you very much, Lucy, and thank you, Sam, for that question. Those questions. I'm going to go now to Laura Coffey. Hello, Laura, from BBC Radio Northampton. Good afternoon.
Hi, good afternoon, Councillor Morris. So I've got a couple of questions. The first one, Deborah, sorry, you cut out just as at the point where you were explaining about the internal incident. So for people that don't know, can you just explain a little more about what is meant by an internal incident? And then my other questions, what's happening with any excess vaccine? So people who aren't able to attend appointments for whatever reason, we know that obviously with the Pfizer vaccine, there's very strict procedures with it. So what happens to the excess vaccines if there are any? And also in August, when the largest outbreak in the country occurred at Greencore, there was a large number of these cases that were asymptomatic. I wonder whether you're surprised that it's only really been in the last few weeks that the government has been talking about testing for asymptomatic people and looking to roll this out. And do you think enough lessons were learnt nationally from the Greencore outbreak?
Thank you, Laura. Some very good questions as always. I'm going to take them in reverse order. So we'll start with Deborah, and then we'll go to Jamie, and then to Lucy. So Deborah.
Thank you. Yes, so sorry I cut out. Kettering Hospital declared an internal incident last week and have been working to internal incident this week. What this means is it's the highest level of operational escalation that we have in the NHS. It's called Opal 4, and it means that you would put actions in place to discharge patients that perhaps you might keep for another half a day, another day in hospital, and try and monitor them at home. It means that the consultants are asked to do additional ward rounds, that we ask families to take patients home to look after them at home if we can't get the care in place for them. So really this is about preventing people to come into A&E and also trying to get additional patients out of the acute beds so that we can manage the demand that's coming in through A&E.
Thank you very much, Deborah. I'll bring in Dr. Green now. Dr. Green.
Yeah, so regarding the question about excess vaccines, I think this is an interesting question, and it relates specifically to the Pfizer vaccine, which has a limited time period from defrost in which you can give it. And the key thing here is that over time, since we started defrosting vaccines, we've realised that, number one, we can get 6 doses out of a vial rather than 5. So we've unexpectedly been vaccinating well over 1,000 when we was expecting it to be about 950. On top of that, we've also known that on a day-to-day basis, if, for instance, one example of why people wouldn't get a vaccine is if the virus beats us to it and they end up getting infected on the day or the day before their vaccination and they can't have their vaccine. We've been able to put steps in place to get new people booked in and have reserve lists for the end of the day. And that's meant that on a day-by-day basis, we've learned how to utilise all of the vaccine, and regularly, every delivery we've had now, we've been able to give well over 1,000 vaccines and waste almost no vaccine, which is a brilliant thing to be able to do. And I can tell you now, the worst thing we'd want to do would be to throw away any vaccine, and we're certainly at the moment not looking at doing that.
Thank you, Dr. Green, for that very good clarification. I'll bring in Lucy now quickly on the Greencore outbreak, which you were referring to there, Laura. Lucy.
Hi, thanks. So Laura, I'm sure you remember it. It feels like an age ago. It was only just over 6 months ago, as you quite rightly say, but we nationally and locally obviously saw a significant reduction in cases. So I think the reason it wasn't considered at that point was, one, the MHRA, the medical sort of regulatory agency, had not signed off lateral flow device testing. It's still in development, so it wasn't sort of freely available or indeed part of the national policy at that point. But also you've got to remember our cases, significantly decreased. And in fact, I'm sure we can remember the heady days towards the end of last summer where we had 2 or 3 weeks freedom, where we were back, going for a drink in the pub, seeing our friends and family, and going about almost normal business at that point. And so I don't think genuinely that the government felt, and certainly from a public health perspective, I wouldn't have felt that they were needed at that point. Clearly, things have changed. We have now obviously got MHRA approval to use these. As I said, they still come with a lot of caveats. People need to recognise that they have limited use. They are not as accurate and will not replace PCR testing in its entirety, but it does allow certain areas with high incidence or that are high risk to reduce that risk. So absolutely appropriate that they weren't used in the first instance from a timing and an approval perspective, but absolutely add value now, used in the right way, in the right setting.
Thank you very much, Lucy. Thank you for those questions, Laura. I'm going to canter on a bit because we're getting quite short of time, as always, with these things. So I'm going to come now to Alice Wilson from Northants Live. Alice, are you there?
Hi, yes, I am. Thank you very much, Councillor Morris. Very quickly, so one for Toby Sanders, if that's all right. What are the earliest and latest times people could be asked to come in for their COVID jabs, possibly for Dr. Green as well? And hospitals and GP surgeries, we've been told by some of our colleagues around the country that they've been quite extreme times of the day. So if you could clarify that, that would be great. And there have been a number of recent stories in national and regional press about a tongue and mouth symptom in relation to coronavirus. So can we find out a little bit more about whether we've seen that in Northamptonshire and if there are any other unusual symptoms? And just finally, obviously, as Dr. Whiteman and Superintendent Foskett have said, there are still people who are mixing in households, and that's the main reason why there's transmission. We've seen that Scotland have restricted their lockdown even further over the last few days. Do you think that's necessary here, possibly in England's worst affected areas, which Northamptonshire sadly falls into?
Thank you, Alice, for those. Thank you very much for those questions. I'll do them again in reverse order. I think I'm going to come to Dr. Green about the times of inoculations and COVID jabs, and possibly Deborah might want to comment on that as well from a hospital perspective. But we'll go to Jamie and then Lucy on that last question that you had. Thank you, Jamie.
Yeah, no, so the current COVID sites we have available, currently vaccinating between 8 to 8. In reality, because the rate limiting step in giving the virus right this moment is the supply of the vaccine, giving the vaccine at this moment is the supply. In reality, we've been able to give the vaccine within fairly sociable hours. So Northampton General Hospital are vaccinating between 8 and 6, and certainly our hub here, our last doses tend to be around 6:30, maybe a little bit later. So in reality, it's all daytime hours at the moment. It doesn't tend to be antisocial. And in relation to the second question, which is about this, the oral and mouth manifestations of coronavirus, one of the things we know is that coronavirus seems to affect all sorts of bodily systems and presents in some unusual ways. And we know the core key symptoms that we're currently testing for, but 20% of people with coronavirus will have symptoms that come elsewhere in the body. Usually that's linked in with other symptoms too, but there's a study going on at King's College Hospital in London where they're looking at symptom diaries and checking what kind of symptoms may be related. And so all sorts of things like ulcers and like oral thrush can present in coronavirus. In reality, clinically, that makes very little difference because quite often they have other symptoms anyway, their cough, their breathlessness, other things that really point towards the coronavirus rather than the mouth symptoms, which can cross over with many other illnesses too. So as a GP, I've not had anyone come to me with a mouth problem that I've thought, oh no, that's coronavirus. We're actually much more seeing the traditional symptoms, although they are getting symptoms alongside and will ask us, well, could this be it or could that be it?
Thank you, Dr. Green. I'll bring in Lucy. Did you want to comment on the question about whether we need further restrictions? I mean, that's a national decision essentially anyway, but you may want to reflect on your views on that.
So, yeah, as you say, it's a national decision. You know, the local decision making was taken away some time ago. However, we do liaise with the Joint Biosecurity Centre, with Public Health England, and any concerns that we have, areas that are particularly of concern around non-compliance, etc., get fed into the narrative around the decision making, both at a regional level and then into obviously the national GOLD and COVID-0 teams. I think fundamentally, if I can be really blunt, and apologies because there's probably all of my press people are going to cringe now, if people just did as they were told, we wouldn't need further restrictions. And I think there are a few that are spoiling it for the many. And, you know, if we actually understood the impact and could see, as Deborah said, if we could go into the hospital and if we could see what Elliot sees around non-compliance and recognise that people are knowingly going against rules that are there to protect people, and that, you know, is tantamount to being criminal, they just need to stop. You know, the sooner we get compliance, the sooner we get our rates down and the sooner we get back to some sense of normality. And as I said, it's deeply frustrating that actually this is not about bringing in more rules and regulations, I don't believe. It's about people doing what they should. And I'm trying to be very polite and not put a swear word in there. And, you know, that would expedite an improvement in our position and get us back to where we all want to be.
Yeah, absolutely, Lucy. I mean, the majority of people are behaving and following the rules anyway. So it seems a bit somewhat draconian to bring down higher levels of control on people who are largely obeying the rules. So I would agree with you with that. But of course, we'll react locally as we need to, as and when things change. So I think I've now got somebody from Global Media Group. Is that correct? I don't know who that would be. Possibly no one. Okay, there's no one.
It's Sarah here from Comms. They submitted the question but said they couldn't be present today, but they will be viewing the footage later today. So
oh, okay, so shall I read it out then, the question? I'll read the question out. So, and this is before Deborah. How are frontline staff bearing up? And there's a lot of bearing up going on with the continuing strain of the high levels of COVID patients. And this sort of plays back very well into everything that Lucy, Toby, Dr. Green, Elliot and Deborah have said previously. So Deborah.
Yeah, thank you. I'll be brief. I think it's fair to say that staff at both hospitals are tired. I can see that when I walk around the organisation. But they are doing the best that they possibly can in such a challenging situation. We have to make sure that we are giving them enough time off, that they're able to take their annual leave, and that we're giving them that support for their mental health and well-being, and we are doing that. I think health and well-being of the staff and their mental health at the moment is probably one of my biggest worries as the hospital chief exec. But they're keeping going. They're trying to be as positive as possible, and they're doing a good job. I'm extremely proud of our staff.
Thank you, Deborah. I think we could go further and say they're heroes. Let's be honest, they are. They're doing an enormous job on behalf of all of us. And, you know, all we have to do is sit at home to keep you safe and keep people safe so that you don't get stressed out too much in your hospital. So thank you for that. I've probably got time for one more. And Neil Barber, you've got your hand up, sir. Good afternoon, Neil.
Hi, Councillor Morris. Probably one for Lucy and probably one for Jonathan. Lucy, right at the start of the pandemic, you mentioned about the issue with getting men to go and get tests, and clearly, from the figures, it looks like that's again the case. What are you going to have to do to get through to younger men and make sure that they do act on any symptoms or anything that they should be? And to Jonathan, Northampton Borough Council was admirably committed to take the homeless people off the streets in the city. Other councils have gone further and are going to give homeless people the vaccine as part of one of the vulnerable groups. Would you consider a plan to give homeless people the vaccine in Northampton?
Very much, Neil. I'll come to Lucy first, if I may.
Yeah, absolutely. So men, generally, you're just a bit bad at admitting that you might not be very well and seeking advice. And sometimes that will just be a kind of a behavior because you don't like to admit that you're not all right. But other times it's because, you know, of your work, you may not be able to access care. But, you know, as Dr. Ween's already said, we've got GP practices open 8 till 8 if you've got any concerns. There's a COVID hotline, you can dial 111. And we've got our local testing sites open 8 till 8 as well. So there's really no excuses. If you've got any concerns, any symptoms at all, we'd be encouraging people to go. And again, I shouldn't have to say it, but, you know, girls, you know, wives, mums, prod anyone that you know who might be male, might not want to test, and but actually might be demonstrating some symptoms to do so. It's really important. You know, the sooner we identify people who have got COVID, the sooner we can get people isolated. And as I've said before, break that onward chain of infection, protect the people that you love, but also protect just the most vulnerable residents locally who otherwise we could be potentially putting at risk. So we do try and tailor some of our comms. We have done some targeted work. We've used more male voices on radio adverts and things like that. But, you know, clearly it is still completely not as proportionate as we would want to. And I think you're right in reminding us, maybe it's something we need to go back and look at again. But no, please do. It's about personal responsibility as well. Everybody's just as likely to get it. So if you've got any concerns, any symptoms, you've got to get that test.
Thank you, Lucy.
Can I just add actually, because there's been an email exchange today, which people may not be cited on, but we are trying to look at Toby and Jonathan. I'm sure you may have seen the email trail as well, but just in case you haven't, we are trying to look at how other people are managing to vaccinate those that are coming into schemes around getting people off of street sleeping. So.
Thank you, Lucy. And we heard today from the comms team that they are doing a TikTok campaign as well, which is very much aimed at the younger members of society to try and get the message through to them, because they don't always watch the traditional media channels that the rest of us do or read the papers. And I must commend the media team on the work that they've been doing. They've been extremely fleet of foot to get in front and behind and in front of messages that have been constantly changing. And I think they've done an incredible job throughout the county. I'm going to bring in Jonathan on the homelessness issue, but I have absolutely no doubt that he would want them to be vaccinated. But I will let Jonathan answer the question.
Yeah, thanks, Ian. Thank you, and thank you, Neil, for the question. And it might be that Lucy's just given us quite insight in there to the answer. Really, I wasn't necessarily aware of other councils being able to do that. Obviously, as Neil rightly says, the everyone in policy is being restored again, and we're using university property again to get everybody in off the street. And it's been a tremendous success from having a night shelter that was just overnight, and then day services such as the Hope Centre, to have people in a certain place where they have a greater level of self-esteem by having their own door and privacy and so on, has seen some people who have been on the streets for over a decade now engaging and sent into more settled or helped into more settled accommodation. So if you're looking for one of the silver linings perhaps of this dreadful virus, you'll find it in what's happened with homelessness. In truth, there's quite a lot of people with strong arguments of prioritising, and to some extent that will be a public health argument and a discussion on how others have chosen to do it. I absolutely believe it's a sign of a compassionate society that we look after people when they most need help, and certainly those that are on the streets are at a time when they most need our help. And actually we also need to be able to access them as closely as we can in order to move them forward. And that's quite difficult with social distancing, to give them the kind of support that will help them really progress their life. So yes, I would be in favour, but I am also aware, and I do get quite a bit of email traffic about a whole bunch of other people who it might be felt have got a very strong argument too. So I think there's some work to do from public health to find out how this has happened elsewhere, and then an overall discussion which does have a bit of an ideological feel to it, given the many people who are exposing themselves to great risk through their work as well, and it wouldn't be totally cut and dried. So I look forward to having that discussion if we can. I look forward to the fact that we can, the people we're now looking after who have been homeless, we can give them the virus. I would hope so. Thank you.
Thank you very much, Jonathan. I understand that we have one more question from Sarah Ward. Sarah, are you there?
Hello?
Hi, Sarah. Good afternoon. We're running very tight on time. I do apologise, but
Just a quick one about, we heard from Corby's MP that there could be a COVID task force coming to Corby to investigate the rates and look at the manufacturing industrial estates. However, government are refusing to confirm this. So just wondering if Councillor Beattie or Lucy Whiteman could give us a bit more information about that, because it seems like there's some cross wires at the moment.
I'm sure both of them are very happy to answer that question. I'll come to Councillor Beattie first as leader of Corby Borough Council, then I'll come to Lucy. Tom.
Yeah, thank you, Ian, and thank you, Sarah. Yes, we're expecting engagement of some sort with a Cabinet Office task force. This was confirmed at a meeting that I was at with Tom Persglove earlier in the week. How that actually takes place in practice remains to be seen. I mean, I think a physical visit by a task force from London probably unlikely given the current circumstances, but there are discussions going on about how that might work in practice. So I'm confident that something will happen, and maybe that we need to meet remotely. We can talk about what needs to be done, what the concerns are. The concerns that were prompted by the letter I wrote to the Prime Minister, Sarah, which highlighted the concern around things like non-essential manufacturing in Corby. And I think that's the sort of thing that a task force from the Cabinet Office could look like. But I understand that there are discussions going on between public health, and I'm sure Lucy can confirm that, about just exactly how that it is going to look, when it's likely to happen. But at the moment, there is no confirmation of how and when that is likely to happen, and that's my understanding. And I'm sure Lucy has something she could add to that, probably.
Thank you, Tom. And it's worth pointing out that we're all on the same page on this one. It's very much a concerted effort across parties and all organisations, that we're all very supportive of your letter and the stance that you took in it. And I'll come to Lucy now to sort of outline the public health side of that. Thank you, Lucy.
Thanks. It's pretty much as Councillor Beattie says. Obviously, he raised a policy concern, which was taken very seriously, and a view shared both by Tom Persglove, MP in the North, but also the County Council and the Public Health team. So that has obviously caused the Prime Minister and the Secretary of State to be interested in those views. And we understand that we'll be told by the end of this week, probably later today, as to how they'd like to take that engagement forward, whether that's, as Councillor Beattie says, a visit seems unlikely under the circumstances, or simply a meeting. It's not about the increasing case rate specifically in Corby. They're very clear that we understand the epidemiology there. This is to explore the policy point that Councillor Beattie was making, and that Tom, Teresa and all of those in the public health team completely support him on, that some areas have a disproportionately high group of workers who cannot work from home, and therefore it increases the risk of COVID, transmission at a population level, and we want that to be explored. They were receptive to that, but we've yet to confirm how and when that meeting will go ahead.
Thank you very much. I will just bring in Elliot Foskett, if I may, because I know he's made a comment in the chat, and I think he's got something very useful to add to this discussion around the industrial estates and people working there. Elliot.
Thank you, Councillor Morris. Yeah, it's not just Corby. We do get regular, certainly over the past couple of weeks, some reports now of people travelling to and from work, sharing cars, 3-4 people in a car, which clearly, when people are mixing households in that way, heightens that risk in that environment. I know that there was some high-profile media attention on one of those, about a week ago, where a car early in the morning was stopped. But we get these reports in, we're now targeting them, so you can expect to see some people out and about on the road in traffic vehicles, in high visibility vehicles, to help stop that happening and prevent it happening, so around the industrial estates.
Thank you very much for that. Toby's had to leave the meeting, so he sends his apologies, but we probably are going to close the meeting now anyway, so he's gone a little bit prematurely. Dr. Green seems to have left as well for the minute. I'm sure he's extremely busy. So thank you everyone for attending, as always. Thank you for the questions. Thank you for everyone on the panel and the answers. Really do appreciate that. I mean, the one message that I would end with, if it's at all possible, is to stay at home, protect the NHS, and act as if you have this disease. It's the safest way to look at this. We can get the numbers down and get the vaccination program rolled out so that we can end this cycle of despair, if you like, around the virus. So on that note, I wish you all a very good weekend and see you again next week. Thank you very much.